Hi everyone, welcome to our channel Canadian Nurse Expert. Today's topic is inflammation. Let's dive right in. Inflammation is a complex process that plays a crucial role in our body's defense mechanism. It is our body's natural response to injury or infection, acting as a first line of defense. When our tissues are damaged, our immune system kicks into gear, initiating a series of events to protect us. It sends white blood cells and other substances to the affected area, creating a barrier against harmful invaders. This helps to protect the body from further harm and begins the healing process. Think of inflammation like a fire alarm going off in your body, alerting you to potential danger. It signals that something is wrong and needs immediate attention to prevent further damage. This alarm is crucial for our survival, as it helps us respond quickly to threats. It helps us fight off infections by mobilizing our immune cells to the site of injury or infection. It also helps us heal from injuries by promoting tissue repair and regeneration. Without inflammation, our bodies would be vulnerable to constant attack from pathogens and unable to repair damaged tissues. We would be unable to repair damaged tissues, leading to chronic wounds and infections. Inflammation is a vital part of our immune system, acting as a bridge between injury and healing. It is a natural and necessary process that helps keep us healthy and resilient against various threats. However, like any alarm system, inflammation can sometimes go into overdrive, causing more harm than good. When inflammation becomes chronic, it can actually start to damage the body instead of protecting it. This can lead to a wide range of health problems, including heart disease, arthritis, and even cancer. Managing inflammation is key to maintaining overall health. Inflammation often manifests with noticeable signs. These classic symptoms are easily recognizable. Redness is a common sign. It occurs as blood rushes to the affected area. Swelling is another hallmark. It is caused by fluid buildup at the site of inflammation. Pain is a frequent companion of inflammation. It arises from the pressure of swelling on nerve endings. Heat is another characteristic symptom. It results from increased blood flow to the inflamed region. These outward signs are often accompanied by internal changes. These include the release of chemical messengers. These messengers help to coordinate the body's immune response. They also contribute to the experience of pain and fever. Understanding these signs is crucial. It allows us to recognize when our bodies are fighting off infection or injury. It also helps us determine when medical attention might be necessary. Inflammation plays a vital role in our body's healing process. It's not just about fighting off invaders, it's also about repair and recovery. When we experience an injury like a cut or a sprain, inflammation is the first responder. It rushes white blood cells to the area to fight off any potential infection. These white blood cells act like tiny warriors, engulfing and destroying bacteria and other harmful substances. Inflammation also helps to isolate the injured area, preventing the spread of infection to other parts of the body. But inflammation's role doesn't end there. It also triggers the release of growth factors, special proteins that stimulate tissue repair. These growth factors help to rebuild damaged tissues, promoting healing and restoring normal function. Without inflammation, our bodies would struggle to recover from even minor injuries. So, while we often associate inflammation with discomfort, it's important to remember its essential role in keeping us healthy and functional. Section 4. The dark side of inflammation when it turns chronic. While acute inflammation is a crucial part of healing, chronic inflammation is a different story altogether. Acute inflammation is the body's immediate response to injury or infection, a short-term process that helps to heal and protect. However, when inflammation becomes chronic, it can lead to a host of problems. It's like a fire alarm that won't shut off, constantly sounding the alarm even when there's no fire. This continuous state of alert can be exhausting for the body, leading to a breakdown in normal functions. This persistent state of inflammation can wreak havoc on the body, silently damaging tissues and organs over time. The immune system, which is supposed to protect us, ends up attacking healthy cells, causing more harm than good. Chronic inflammation is often linked to lifestyle factors like smoking, which introduces harmful chemicals into the body that can trigger inflammatory responses. Obesity, which puts extra stress on the body's systems, and chronic stress, which keeps the body in a constant state of alert, are also significant contributors. It's also associated with certain medical conditions like autoimmune disorders, where the body's immune system mistakenly attacks its own tissues. This can lead to conditions such as rheumatoid arthritis and lupus, which are characterized by chronic inflammation. Over time, chronic inflammation can contribute to a wide range of serious health problems. These include not only autoimmune diseases but also metabolic syndrome, type 2 diabetes, and neurodegenerative diseases like Alzheimer's. It can damage blood vessels, increasing the risk of heart disease and stroke. The inflammation can cause plaque to build up in the arteries, leading to atherosclerosis, which can result in heart attacks and strokes. It can damage joints, leading to arthritis and chronic pain. This is particularly common in conditions like osteoarthritis, where the cartilage in the joints breaks down due to ongoing inflammation. Chronic inflammation is even linked to an increased risk of certain cancers. The constant state of inflammation can cause DNA damage, which can lead to the development of cancerous cells. Therefore, managing chronic inflammation is crucial for maintaining long-term health and well-being. This can be achieved through lifestyle changes such as a healthy diet, regular exercise, and stress management, as well as medical interventions when necessary. Section 5. Inflammation's assault on the liver, a complex relationship. The liver, our body's powerhouse organ, isn't immune to the damaging effects of chronic inflammation. In fact, chronic inflammation is a leading cause of liver disease worldwide. The liver is responsible for filtering toxins from the blood, producing bile for digestion, and playing a crucial role in metabolism. When inflammation persists in the liver, it can disrupt these vital functions, leading to a range of complications. One of the most serious consequences of chronic liver inflammation is cirrhosis. Cirrhosis occurs when healthy liver tissue is replaced by scar tissue, impairing the liver's ability to function properly. This scarring can result from various factors, including chronic hepatitis B or C infection, excessive alcohol consumption, and non-alcoholic fatty liver disease, which is often linked to obesity and diabetes. Understanding the link between inflammation and liver disease is crucial for prevention, early detection, and effective management of these conditions. Section 6. Cirrhosis, a silent threat to liver function. Cirrhosis is a serious liver condition that can have devastating effects on overall health. It occurs when healthy liver tissue is replaced by scar tissue, a process known as fibrosis. This scarring prevents the liver from working properly, impairing its ability to perform vital functions. Cirrhosis is often a silent disease, meaning it can progress without noticeable symptoms. It may not cause symptoms in its early stages, making early detection challenging. There are many causes of cirrhosis, each contributing to the damage in different ways. The most common causes are chronic infections with hepatitis B and C viruses. These viruses infect the liver and cause persistent inflammation, leading to damage over time. Over time, this chronic inflammation can result in the development of cirrhosis. Another common cause of cirrhosis is long-term alcohol abuse. Drinking excessive amounts of alcohol over many years can severely damage the liver and lead to cirrhosis. Non-alcoholic fatty liver disease, or NAFLD, is another growing cause of cirrhosis, especially in developed countries. NAFLD is closely linked to conditions like obesity and diabetes, which are becoming increasingly common. Cirrhosis can lead to a number of serious complications that can significantly impact a person's quality of life. These complications include ascites, which is the buildup of fluid in the abdomen, variceal bleeding, which is bleeding from enlarged veins in the esophagus, a potentially life-threatening condition, hepatic encephalopathy, which causes confusion, memory loss, and other mental changes, jaundice, which is characterized by the yellowing of the skin and eyes due to the liver's inability to process bilirubin, hepatorenal syndrome, a type of kidney failure that occurs in people with severe liver disease, and acute liver failure, which can be fatal. Treatment for cirrhosis depends on the underlying cause and the severity of the condition. It may include lifestyle changes, medications, and in severe cases, liver transplantation. In conclusion, inflammation can have serious impacts on your kidneys and liver if left unchecked. It's important to recognize the signs and take steps to protect your health. Our bodies have an incredible ability to defend and repair themselves, but they need our help. Simple lifestyle changes like a balanced diet, regular exercise, and avoiding excessive alcohol can go a long way in preventing chronic inflammation. Additionally, staying informed and seeking medical advice when necessary can make a significant difference. Remember, your liver and kidneys are vital to your overall well-being. Treat them with care, and they'll work tirelessly to keep you healthy. Thank you for watching. Don't forget to like, share, and subscribe for more informative content. Stay healthy and mindful.